online learning environment. If you suspect ADHD, the experts at San Antonio Counseling and Behavioral Center can help.
Dr. Martha Livingston, thank you so much for joining us this morning on Great Day SA. You're with the San Antonio Counseling and Behavioral Center, and you're going to talk to us a little bit about ADHD at home in children. So thank you so much for sharing your time with me.
Yes, thank you for having me.
And so when it comes to ADHD, it's a biological issue. Can you explain a little bit about what that looks like?
Sure. ADHD is a neurological condition, and it is three-pronged. It's children who experience hyperactivity, inattentiveness, or sometimes a combination of both, hyperactive and inattentive at the same time. ADHD will affect the child in any task that requires sustained mental effort. So if it's something that requires for them to focus, pay attention, it's going to be very challenging for them. So some of the things that the parents can do obviously is minimize the distractions, set some kind of structure and like a system where the child knows what's coming next. Breaking down assignments or tasks, they can't sit there for an hour at a time, so maybe breaking it down to 15-minute increments with little breaks in between. Definitely the use of positive reinforcement, giving positive feedback so the child knows they're on track.
How do you feel parents should best treat their children if they do have ADHD?
Sure. The efficacy of ADHD in terms of its treatment is always the combination of therapy and medication. I always advocate to start with implementing some of these strategies, receiving counseling, and then if the symptoms do not, get better, then obviously go on medication. That's going to be up to the individual parent to consult with their pediatrician and child psychiatrist to see if that's an option.
Now that kids are at home, what should parents be looking for if they suspect their child could be struggling with ADHD?
Sure. If the child, has a difficult time staying focused, even after a lot of redirection, and that it's very challenging for them, then maybe it's time to consult with a therapist or a counselor to see if we can do an evaluation or just to rule it out. Most kids will get distracted, but sometimes when it's too much, even when there's rewards or we set consequences and this child still has a hard time, finishing an assignment, then, maybe it's time to kind of look at what's really going on. Parents usually bring their children when they feel that they've tried everything, if they've tried, setting the schedule, doing positive reinforcement, all of the things that typically we do to get the child to comply, and still it doesn't work. Usually the teachers are trained through their studies and also through in-services on how to look out for these behaviors and maybe refer them to the counselors to do evaluations, but the parents at home don't have access to those resources.
And how can people get in touch with you if they want to schedule an appointment or maybe learn more about this?
Sure. We are at 210-614-4990, and we have therapists, even virtual counselors that you can access from the comfort of your home. Ask us about how most insurances are waiving copays during this pandemic, and so that means no out-of-pocket costs for the parents in many cases.